So I'm Andrew Soldan, I'm head of the APHA Scientific, which is part of the UK Government Animal and Plant Health Agency. The APHA is the government veterinary agency in the UK, responsible for a whole load of things, but one of those things is research and development, and we are an OIE reference laboratory for brucellosis, amongst other things. And so we do work for the British government on looking for better diagnostics for brucellosis. We've eradicated brucellosis now, but we still have an active screening surveillance system to actually can make sure it doesn't come back again. And there are still some disadvantages with existing diagnostics, even without vaccination, that we've been trying to solve. So I worked in Malawi for 5 years for DFID, looking at diagnostics in that country, cattle, and also in poultry. And so I've always maintained an interest in what's going on in developing countries, and I've done a lot of work with diagnostics and always looked for diagnostics which are useful both out of the laboratory, so actually that may be in an outbreak of FMD or a disease in the UK in a forward operating base where you've got non-trained staff, not a full lab facilities, and there's a lot of then parallel to some of that technology may then be very useful in developing countries where again you're effectively just in another resource poor situation. There are differences obviously, but the same sort of technologies are likely to be useful. So we've done a lot of work on kind of isothermal amplification, that sort of thing, where can have very cheap machines, cheap disposable devices. And one of the big challenges is that the vaccines that we have severe limitations. So in the UK we did eradicate brucellosis using current vaccines, but that required a huge amount of organisation, a huge amount of government law passing to enforce sometimes doing things and sometimes stopping things, and that's very difficult to do. I'm not sure we can even do it in the UK now, let alone being able to do it in developing countries. So on the competition for the vaccine, I think it's a fantastic idea. I think in my discussions I've already had with vaccine companies, it has created a level of interest that means that they're prepared to, let's have a talk about that, let's have a discussion about that, which I think is a testament to the fact that it's already started to have an effect. It's certainly raised the level of interest within the industry, both the research community but also the vaccine companies.